See about the stomach. So normally stomach is the distensible organ in the abdomen. So first in the introductory part we have to write, or we are going to see about the function of the stomach. Okay. So the main function of the stomach is to produce HCl and intrinsic factor. So HCl, which involves in the digestion process and gives the acidic medium in the stomach, whereas intrinsic factor, which involves in the absorption of the vitamin B12. Okay. And coming to the location of the stomach, normally it is a left side organ in the abdomen. So it is presented in the left hypochondrium, epigastric region and umbilical region. So the stomach covers all these region in the abdomen. So coming to the capacity of the stomach, normal capacity is 1500 to 2000 ml in an adult. Okay. So coming to the external features. So external features of the stomach. First we have to see the curvatures. We have lesser curvature and greater curvature. Okay, this lesser curvature is related to the lesser omentum, whereas this greater omentum. Okay, first there are two curvatures, lesser curvature and greater curvature. And coming to the ends, we have two ends in the stomach, cardiac and pyloric end. Cardiac end is presented between the esophagus and the stomach. Pyloric end is presented between the stomach and the duodenum part, first part of the duodenum. So, coming to the surface of the stomach, we have anterior surface and posterior surface behind the stomach. Okay. So, external features, we have two curvatures, two ends and two surface. Two curvatures are lesser and greater curvatures. Two ends are cardiac and pyloric end, and two surfaces are the anterior surface and posterior surface. So coming to the parts of the stomach, we have fundus, cardiac part in body and pyloric part. Okay, so all these are the parts of the stomach. So coming to the shape of the stomach, normally the shape of the stomach is J-shaped or inverted L-shaped, but we have semilunar shaped and steerhorn shaped. So this is the inverted L shape, it is the J shape. Okay, this is the semilunar shape, which is like something about the moon, and this is the steerhorn shaped. Okay, these are the different types of the shapes in the stomach. So coming to the relations, first we have to when we are going to discuss about the relations, we have to discuss two types of relations. One is peritoneal relations and visceral relations. Coming to the peritoneal relations of the stomach, normally the stomach is covered by the peritoneum, but except when the blood vessels which is around the stomach and the back area of stomach are devoid of this peritoneum. The peritoneal fold which is presented around the stomach are lesser omentum, greater omentum. As I said, the lesser omentum is presented around the greater curvature, greater omentum is presented. And two ligaments, gastrosplenic ligament, gastrophrenic ligament. Gastrosplenic ligament which connects the stomach to the spleen, whereas gastrophrenic ligament which connects the stomach to the diaphragm. Okay, these are the peritoneal fold which is presented around the stomach. Coming to the visceral relations, anteriorly we can see the anterior stomach is related to liver, and it is related to diaphragm, and it related to the anterior abdominal wall. So mainly the anterior visceral relations of the stomach is related to three viscerals, three organs. One is which is related to the liver. Okay, so this part is related to the liver, and this part is related to the diaphragm, and this part is related to the anterior abdominal wall. So there are three relations, okay, in the anterior surface of the stomach. Coming to the posterior relations, we have posterior relations. We can say it as a stomach bed, okay. So you can see the diaphragm, left renal gland, left adrenal gland, left kidney, spleen. So normally, as I said, the stomach is something which is present in the left side of the abdomen. So in left side, what are the organs are presented and what are the organs are related to the stomach, we will see in the stomach bed. So here you can see the stomach. So below that, what are the structures are presented? Normally, transverse colon, transverse mesocolon, transverse colon, kidney, left renal adrenal gland, and spleen. So this part is related to stomach, okay, and the diaphragm. So these are the, and some part of pancreas is also related to the posterior side of the stomach. So coming to the blood supply, normally there are 5 arteries. First is left gastric artery, which is a direct branch from the celiac trunk. This is the celiac trunk. So first at the artery which we are going to see about the stomach is the first artery is the left gastric artery, which is a direct branch of the celiac trunk. Coming to the second, right gastric artery. So right gastric artery is a branch of common hepatic artery. So common hepatic artery is a branch of celiac trunk. Okay. So third, short gastric artery. So short gastric artery is a branch of splenic artery. Splenic artery is a branch of celiac trunk. So coming to the left gastroepibloic artery, it is a branch of splenic artery. Again, it is a branch of celiac trunk. Coming to the right gastroepibloic artery, so it is a branch of gastroduodenal artery, which is a branch of common hepatic artery. So this common hepatic artery is a branch of celiac trunk. So these are the 5 branches which supplies the stomach. So all these branches are commonly arises from the celiac trunk. Okay. So I'll repeat it again. See, in the left gastric artery, which is a direct branch of celiac trunk. So right gastric artery is a branch of common hepatic artery. So common hepatic artery is a branch of celiac trunk. These two. Okay. Then short gastric artery is a branch of splenic artery. So splenic artery, again, it is a branch of celiac trunk. So left gastroepibloic artery is a branch of splenic artery. Splenic artery is again a branch of celiac trunk. So right gastroepibloic artery is a branch of gastroduodenal artery. So again, it is a branch of common hepatic artery. So common hepatic artery is a branch of celiac trunk. Okay, these are the arterial supplies of the stomach. Coming to the venous drainage. So somewhat the venous drainage is common with the arterial supply, but there are differences. Okay, they are not, the branches are not same from the same like celiac trunk. So all those are the difference. So first is the first part what you are going to see is the portal vein. So portal vein is formed by the superior mesenteric vein and splenic vein. So this is the formation of the portal vein. But what are the veins which supply which drains the blood from the stomach? So first is the left gastric vein. Is a direct branch of the portal vein. And right gastric vein, again it is a branch of portal vein. So first vein which we are going to see in the stomach is the left gastric vein. So it is a direct branch of the portal vein. Coming to the right gastric vein, it is also direct branch from the portal vein. Coming to the short gastric vein, it is a branch of splenic vein. Okay, so splenic vein forms the portal vein. And left gastroepibloic vein, it is a branch from the splenic vein. And Coming to the right gastroepibloic vein, which is a branch of superior mesenteric vein. Okay, so superior mesenteric vein, gives the branch to the right gastroepibloic vein, which drains the blood from the stomach. Okay, these are the 5 veins which involves in the stomach. Okay, so coming to the lymphatic drainage, stomach is divided into 4 parts. Okay, so first part, second part, third part, fourth part. Okay, so stomach is divides into 4 parts. So this 4 parts, it's going to drain into the surrounding lymphoid nodes. Okay, so first I will say you the lymph nodes which surrounds the stomach, which is presented around the stomach. So first is the celiac node. Around the celiac node there are 2: left gastric node, right gastric node. And around the stomach we have at the end pyloric node, at the middle right gastroepibloic node, and pancreaticosplenic node. These are the nodes which involves in the drainage of lymphoid around the stomach. Okay, so from the first part it drains into the left gastric node. From the third part it drains into the pancreaticosplenic node. From the fourth part it drains into the right gastroepibloic node and pyloric node. Whereas from the second part it drains into the right gastric node. So from all these nodes it drains into all these nodes will finally drain into the celiac node. Okay, this is about the lymphatic drainage of the stomach. So coming to the nerve supply, it is most important thing. So commonly vagus nerve involves in the nerve supply. So this vagal nerves is dividing into right and left. So left continues as the anterior trunk and right continues as the posterior trunk. So from the anterior trunk we have 3 branches. Okay, celiac branch, hepatic branch, anterior nerve of lateral. So all these supplies the stomach in the anterior part. Okay, so coming to the posterior trunk, again it is 3 branches: celiac branch, nerve to Gracie, and posterior nerve of lateral. So all these supplies the posterior aspect of the stomach, and nerve to Gracie it supposes which supplies the mainly fundus of the stomach. Okay. So coming to the applied aspect, we have gastric ulcer, gastric carcinoma, and vagotomy. So first, gastric ulcer. Ulcer is something which damages the lining of the stomach due to the hypersecretion of HCl or due to some of the infections. So this causes the gastric ulcer. Coming to the gastric carcinoma, gastric carcinoma, the perforation of gastric cells, so normally which destroys the gastric contents. So the gastric ulcer, the common site for the gastric ulcer is along the lesser curvature, whereas gastric carcinoma mainly occurs in the greater curvature. Coming to the vagotomy, we have 3 subdivisions under it: truncal vagotomy, selective vagotomy, highly selective vagotomy. So truncal vagotomy is something which involves in the cutting of the vagus nerve. So it is subdivided into these 3 things, these 3 types, based on the position of the cut of the vagus nerve. Okay. So in truncal vagotomy, normally it divides into hepatic and celiac branches. So before that, before giving these branches, the vagus nerve will be cut. Whereas in selective vagotomy, after giving these branches, hepatic and celiac branches, the vagus nerve is going to be cut. In highly selective vagotomy, the anterior and posterior truncal vagus will be cut, including the nerve of Gracie. Okay, so these are the applied aspect of the stomach. Thank you.